Hi, welcome to Case of the Day, and we're now on our 72nd case. 72 cases, that's a lot. And today it's titled "A Ghost Sign and Erosive Arthropathy Confirmed Foot Infection." On follow up, the 63-year-old was operated for a corn bursa overlying the fifth MTP joint. This was an MR done before surgery. It shows abnormal soft tissue here. The bone joints are all normal. That's a T1, a stir, that's a PD fat sat, sagittal, and a stir axial. And the patient was operated. The wound did not heal. The patient is non-diabetic, and so 4 months later, the patient came for an MR, and at that time, we saw that on the T1 there was no significant change. A little bit of increased signal in the marrow, but nothing great. There was edema on stir, a little bit of enhancement on the dynamic contrast, but nothing else. The joint was also normal. And so we said this is osteitis, not osteomyelitis at this stage. And the patient was treated with antibiotics and basically conserved. But things did not improve. They kept worsening, and the patient came back over the weekend. And now you can see there's disruption of the joint. You see an erosive arthropathy here at the MTP joint, frank erosion with effusion. The texture, I mean, if you can call it that. So, one is, of course, you have this T1 dark, which kind of is a sign, it looks like a ghost here. And then you have this heterogeneous signal on stir. The diffusion shows uptake in the coronal plane, and there's heterogeneous enhancement on the dynamic contrast study. And this is now frank osteomyelitis with arthritis. And just to put all of this together, that was in August before surgery, the bone joint absolutely normal. Jan, some edema of the proximal phalanx, but still no evidence of frank osteomyelitis or arthropathy. And then just 3 days ago, you can see here that there's frank osteomyelitis and arthritis. And the way we are making the diagnosis is we see an erosive arthropathy. In the context of a soft tissue infection, this means that this is septic arthritis. And this appearance on T1 where the bone appears eaten away or ghosted away is suggestive of osteomyelitis. And there was an article from Avnish Chabra's group in the IJRI earlier this year which talks about it. And there are some very nice images if you'd like to see it. Anyway, it's all free because the IJRI articles are free. So, a ghost sign on T1 and erosive arthropathy are reliable signs of osteomyelitis and septic arthritis, respectively, especially in the foot, in the setting of soft tissue infections when we want to know whether the bone and joint are involved or not. That's the REF classroom, the WhatsApp channel. Thank you so much for viewing this.